Hi, my name is Emily. I'm a family nurse practitioner student, and I'm here to do an assessment on your skin and nails today. I'm specifically looking for any areas of hyper or hypopigmentation, or any areas, lesions, scarring, nodules, anything that you are concerned about or that you've noticed lately.
No, there's not.
Okay, I'm going to start by inspecting your arms. Just going to start at the top of your arms. I'm again looking for any scarring, cracking, dryness, any nevy or misshapen moles. I'm also looking at the temperature. I'm going to assess the temperature of your arms with the back of my hands, and your arms are warm and there's no clamminess, no excessive oiliness, no scaling, no flaking. Come down to your hands. I do see that there are some smooth, round freckles here on your hand. Are these new for you or have they changed lately?
No. No.
Okay. They are symmetrical, their borders are regular, their diameter is less than 6 millimeters, and they have not been changing, so I'm not concerned about them. I'm looking at your hands, looking at the color of your nails, looking to make sure there's no clubbing, that your nail beds are pink, that there's no cyanosis. And I am going to check the skin turgor by pinching the back of the skin here to make sure that it returns to normal in less than 3 seconds. This will help assess your hydration. Okay, and it returns immediately, so there's no signs of dehydration here. Okay, immediate returning, and they're equal and bilateral on both hands. Now I'm going to take a look at your face and your trunk, looking again for any scarring, any abnormal moles or hyper or hypopigmentation, any cyanosis as well, which is a bluish color, or pallor, which is a paleness to your skin. I'm going to use my pen light and look at your oral mucosa and your lips. Go ahead and open your mouth for me. Move your tongue from side to side, please. And look at your hard palate. There's no cracking. It's nice and moist and pink. There's no flaking and no signs of cyanosis around your lips. Your lips are not cracked. They're nice and moist. Could you remove your glasses for me, please? I'm going to use my fingers to pull your eyelids down to look for jaundice. So I'm going to shine the light in your eye just so you're aware. Just looking for a yellowing color, which I don't see any. Okay, maybe this on the other side as well. Just looking again for any kind of discoloration, specifically jaundice or a yellow color. Okay. I'm going to inspect your hair and your scalp for any nodules, scarring, lesions, any hypo or hyperpigmentation, any nevy that might be concerning. And I'm going to also look at the distribution of your hair and part your hair in a couple of different areas to make sure that there's not an unevenness to the distribution of your hair. Okay, you do have a thinning texture, fine texture, and an area of alopecia here on the back of your head. I do see a smooth little nodule here. Is that been there for a while?
Yes.
It hasn't changed recently that you're aware of?
It is not.
Okay, very good. I'm going to come around now to the posterior side of your thorax to inspect your back for any scarring, lesions, nevy. Have you noticed any changes to any moles in the back?
I have not.
Okay. The temperature on your posterior thorax is warm and dry. There's no scaling, no flaking, no lesions. Okay. Now if I could have you scoot back, and so your legs are out. There you go. I'm going to assess the color of your legs, assess for any scarring, lesions, nevy, any changes or hyperpigmentation that you're concerned about here.
No.
Okay. The size is symmetrical on your legs. The temperature is warm and dry. There's no temperature variance. No sweating, no clamminess. The temperature of your feet are equal bilateral. I'm just taking a look at the hair distribution on your toenails. There's not a lot of hair here on your toenails. Is this normal distribution of hair for you?
Yes.
This has not changed recently?
No, it is
Okay. I'm just taking a look at your toenails, making sure that you must have dropped something on your toe there.
not. I did.
Just making sure that they are nice and pink and that there's no clubbing or cyanosis that would indicate poor circulation. And there is none of that noted. Thank you very much.
Thank you.